This is our last workshop today of a 6-part series, Finding Calm in the Storm using EMDR. And we have been working the past several weeks with phase 2 of EMDR to work on strengthening our resources to be able to manage disturbance, distraction, or other parts of the journey that might feel challenging. So I do hope that it's been helpful for you. I hope that there's been some tools or skills that you've been able to use or practice. As I mentioned, we're doing a kind of sample of all. What I was saying is that any of the skills that we have practiced are a practice. So just like anything, it can take some time to develop. So I would encourage you, if any of these that we have done together have been helpful, to stay with it, keep developing it and practicing it, and link to your resources. I'm also hopeful by giving you the names of some of these exercises, or by even just sampling or trying them together, that you'll have the language that you can talk to providers and ask them to practice with you. I think we have some things that we've continued to support Unite for Her with workshops and places to gather. So we'll do what we can as EMDR providers to support you in learning and practicing some of this as well. So going back to the beginning of our time together, I had mentioned that EMDR is a modality. It's a manualized approach to treatment. It's evidence-based to working with that traumatic experiences that can get locked in our brain as unprocessed, carrying with them the same parts of the memory or experience attached, the associations, the images, the thoughts that might be negative thoughts, emotions. So we work to reprocess that, because we can get triggered or activated, and we can have the same kind of old response come back and sort of hijack our nervous system and our ability to stay connected in the moment that we're in the here and now. So with the workshop that we've been doing, like I said, we're in phase 2. Phase 1, if you were to go find an EMDR provider, or you already are working with an EMDR provider, then you'll know that phase 1 is about gathering history, and the therapist is assessing how stable you are in terms of being able to do some of that, go back into some of the trauma memories and work through it. Especially if you have any sort of medical complications, it's important for that provider to assess, because as you go in traumatic experience, you're basically inducing a little bit of that stress to be able to desensitize to it. So it's important for that provider to assess, is inducing some of that stress, could that exacerbate any of your condition? So I would encourage you to, that is the time in phase 1 to be able to go through and assess if it's where to go in terms of a treatment plan with EMDR. No matter what, phase 2, like we've been doing, is appropriate for anybody. It's a lot of these skills and tools are what we need. We are linking to our adaptive networks in our brain and working to strengthen them. So working to bring new places to go, and new connections and new tools, so that when you do the trauma work, you're able to access that more easily. So even if it's difficult, like there's some medical instability in terms of like going through the trauma reprocessing, you still will be able to practice some of the phase 2 techniques for as long as you need, because that's going to help you, like I said, in the here and now. with present triggers and activating events, having, ways to manage that aren't just new ways to think about it, but also kind of working. EMDR does a lot of work with the mind and the body and the emotional responses attached. So I would like to quickly review all of the things that we have been doing together in the past 6 weeks, so that you can see how far you've come and all the different tools that we've practiced. So we started by creating some containment places to put disturbance or distraction to help us to manage it differently. This is not to ignore the powerful things that have happened, but to give you the opportunity to decide when and how you come to terms with it. We've also practiced calm state by really bringing a place and using imagery in the mind that links to a calm or a safety. And we strengthen that in our third session using bilateral stimulation. And I explained some of what that was in the third session. Then we activated a little bit of annoyance and practiced shifting back to a calm state. We practiced the light stream technique, going to disturbance where we experience it in the body and working to shift it and change it from there. And last week we worked on recognizing when we get activated or triggered, sort of how how close we can feel to that sort of blocking view of other resources or things in our life. And we used mindfulness and some deep breathing to be able to give us a little bit of space, allowing whatever is happening to be something that's happening outside of us, and to give us space to get sight of all of our other resources. So even slowing yourself down and finding your breath is actually communicating, even though your mind and your emotions may be sensing fear and danger, or it might be activating a lot of negative thoughts. Even if you can find your breath and get the ground beneath your feet in the here and now, and use some of those mindfulness techniques to be able to take some deep breath, it actually communicates to your brain another message that can help you to slow down and get a little bit more control over how to respond or where to go next. And we practice that using internally by using a technique called the stadium technique last week. So I wanted to say that if you've been with us the whole time, we've come a long way. If you do take, I wanted to give you a sense of what EMDR is in the whole. If you do continue to move forward, and you are working with an EMDR therapist, the next several phases are the reprocessing phases. And I want to give you a quick idea of what that looks like. That in phase 3, it's assessing. It's going into a target memory or experience that again, your therapist will help you determine the level of disturbance that it's at. And we collect the image that represents the worst part of that. We collect the negative cognition or negative thought that is attached to it. For example, it's typically an I am, like I am in danger, or I am not safe, or something else that connects to a negative belief that accompanies that event or that experience. And then after that, we talk about what is a preferred belief that we want to believe about ourselves instead. And we call that the positive cognition. How much do we believe? How much of that do we believe now? We check the emotion that we have when we activate the event, where we feel that in our body, and the level of disturbance that we feel that in that moment. And then we go into a reprocessing phase. So today, I like I said, we're not doing reprocessing in these sessions, but you may have. I thought we could kind of practice today by just thinking about, maybe an activating event for you, either in the present or in the past. Um, Thinking about sort of an image that represents the most difficult part, uh, or most the that sort of represents the worst part of it. So, um, what is the negative belief that links to that? And then what is a belief that you would prefer to believe about yourself now instead? So just, it's hard because we can't interact over the computer in the Zoom, but just to kind of give you a sample of what, again, what sort of negative belief might be connected to that image. And I thought we could lean into the idea of what is the positive belief I'd prefer to believe about myself now instead. Um, so maybe it's something that if you have a pen and paper, those are some things to maybe write out. And I wanted to see how we could maybe strengthen together as a group that positive cognition that you'd prefer to believe about yourself now instead. So, for example, it could be a image that comes to mind that is connected to um, an experience that uh, was particularly stressful or scary. And maybe the belief is I am alone. And maybe a preferred belief would be that you'd prefer to believe now would be I have connection. So, what I want to do with our call is, again, we're not going into reprocessing, but how to think about ways to strengthen that positive cognition, even just by leaning into it for a couple of minutes together. So, again, if you had a pen and paper and you're kind of penciling out, and my example is I am connected. But thinking about what positive belief you might need to, that you'd prefer to believe now. I am safe now. I'm not alone. Um, it's not my fault. You know, just seeing if you can identify what that is. And then I want to see if we can, as we do our deep breathing exercise and centering exercise, there's some ways that I want to see if we can kind of, even just by coming into the present moment, centering, grounding ourselves, and bringing that belief to mind, ways that we can take some deep breaths and link to that belief now. And then as we leave from here, I want to encourage you to think about maybe things that you could do um, throughout the rest of today that might be ways to help strengthen that belief. So maybe it's linking to, for example, people or activities or places that help to remind you of that. So, all right, taking a few moments, we're going to practice in this remaining time. We're going to practice uh, just another grounding technique, and again, I'm going to try to pair it with that positive cognition to help strengthen it for you today. What I want you to do is see, we're going to start by noticing using the four elements. We're going to start by noticing the ground beneath our feet and using the element we can call earth. We can just allow ourselves to experience earth and the ground beneath our feet and help to create some safety and in our present reality. So taking a minute or two to just land, to be here now, placing both feet on the ground again and feeling that chair supporting you. You might look around the space that you're in and notice 3 new things or 3 things in your environment in the here and now, and just have a gentle curiosity, noticing maybe the color, the shapes, or the size of those 3 things, gently guiding your mind just into this present moment, noticing what you see and what you hear, and then taking our the next element, which is air, and taking some deep breaths, using that breath for centering. You can do your favorite breathing exercise here, just breathing in and breathing out, whatever way feels comfortable for you here today. You may breathe in for 4 seconds, hold for 2 seconds, and then slowly breathe out. So taking another couple deep breaths, allowing yourself to center. Good. And noticing that as attention is directed, you might feel a bit calmer or more focused, a little more in control. And then we're going to, if your eyes are closed, bring it into your mind's eye. If they're open, just have a soft gaze in the room and see if you can light up in your imagination a space or a place that feels calm or something that links to safety, and noticing as you bring that to mind where you how you feel and where you feel that in your body. And if you want to add bilateral stimulation, just gentle tapping as you bring your attention to feelings of safety and calm. Right. And as you are sensing now, grounding, safety in the present reality, centering, using your breath, and lighting up your imagination to a space or a place that feels calm. You may bring those words that you wrote about at the beginning of needing to feel more, um, more of, or connected to what you'd prefer to believe. And I want you to imagine that your hand sort of carries that belief with it. And as you take some deep breaths and continue to breathe, you bring that hand over your heart and bring that message to yourself in this moment right now. And you might continue to use your um, imagination and your mind, bringing uh, experiences or connecting to places inside of you where you have felt that um, positive belief before, or how you can even sense it in this moment. So, for example, I am connected, maybe even just taking a minute, which was mine, kind of taking a minute, and I'm bringing that message to myself now. And I'm bringing to mind the connection I'm having with all of you right now. And I'm just breathing that in. Yeah. So And so we come back to external awareness. Right? Take a stretch to orient back to the space. We used a little bit of this exercise to just talk more about EMDR as a whole and just understand what other phases look like, and just sort of leaned into a positive cognition connected, um, and tried to work to strengthen it using some of the skills that we've already used. And again, we're just sampling some of this, but I encourage you all to continue uh, linking to resources. I'm in your community. I work with Unite for Her, and I'm a partner with them. If there's anything that I can do as a resource in your community, if you have questions or um, ways that I can support you as you learn more about EMDR or practice any of these skills, I'm happy to do so. So it's been wonderful to be with you for the last 6 weeks. And I look forward to, again, being a part of your community and here for you if you need anything going forward. So thank you for joining today.